things that I'm going to need to have, my equipment for my patient. I'm going to need to have, I always bring in at least one, if not two, extra sterile gloves. Because if I contaminate myself or something, I need to pitch them off and put new gloves on, right? Okay, so extra gloves. You also need clean gloves, and I never only grab two. Because invariably, I will get something nasty on it, and then, or it'll rip when I put it on, and then I'll need new gloves. So get several pairs of gloves. You also need to have sterile cotton-tipped swabs. Sterile. And I'll show you why you need them sterile. You'll need a tape measure and a roll of tape, extra tape, because the little wimpy tape that they put in there is never long enough and not ever. You'll need some hand sanitizer. You'll need some drapes or blankets for your patient because we are going to expose the wound. And, okay, so I think that's all, and then your dressing changing tray. Okay, so when you go, the first thing you're going to do is you're going to assess the doctor's order. You're going to see what kind of a dressing you've got to do. If it's a wet to dry, if it's just a dry, if it's a packing dressing, what kind of dressing that you need to do. The second thing that you're going to do is you're going to assess the patient's pain level a half an hour before you do this. If you know they've got a dressing change due at 7, go at 6:30, and that's when you would medicate them, a half an hour before any procedure like this, because some of these can be very painful. I mean, that tissue is so tender. So you would medicate them, you would assess their pain level. Okay, so after I've done this, let's say it's been a half an hour, then I go into the patient, I talk to the patient, identify myself, let him know that I'm going to be his nurse today. Hi, Mr. Jones, can you tell me what your name and your birthday is? You identify your patient, okay? After you have identified him, you explain the procedure and you tell him, Mr. Jones, we are going to be doing a dressing change on that leg right there, so I'm going to be taking that old dressing off and I'm going to be putting a new dressing on. But I need you to try and not touch this area because it is sterile. And some of the stuff that I'm going to be touching is sterile and we need you to not touch it, so try and keep your hands away from that if possible. If it hurts, you can let me know. So then after you assess him, explain the procedure, you're going to lift the bed up to a comfortable position. Obviously I can't because this is a gurney. You're going to drape the patient because you want to keep the patient covered because this may take a little bit of time. So you may want to just drape him and only expose the area that you're going to be working with, okay? Which is just the leg. So you're going to only expose just the leg, okay? All right, then you're going to do some hand hygiene, all right? And you're going to provide privacy, because this isn't your time. And you're going to don some clean gloves on. Okay. Then you are going to take the old dressing off. When you take the old dressing off, you guys, make sure that you hold pressure on the other skin below it so that it doesn't rip and tear that skin. So just hold pressure and kind of slowly and gently. Boy, Maria put these on awesome. Like, I can't get it off. I have to tell her. I'm going to dress all my wounds. Okay, the other thing is when you guys take wounds off, don't let the patient see the dressing. Like, you don't want to take it off and hold it up.
Nicole, look at that.
And go, ew, look at this. Okay? So you kind of want to take it off away from the patient and then just kind of look at it, and you're going to document what the dressing looks like. So if it's got, you know, I would say that these are both saturated, 2 saturated 4x4s with sanguineous fluid, right? And you're going to throw those in a garbage. And then there's 2 more on the inside that were also saturated with sanguineous fluid. So there was 4 4x4s that were saturated with sanguineous fluid. Or it's probably more serous because it's more of a serous sanguineous. Then I'm going to look at the wound. And I'm going to assess what the wound looks like. You know, it's kind of got the beefy red on the inside. It's Its edges are a little bit pink, but they don't look infected. There's no yellow or other discharge. There's no foul odor. Then I'm going to measure this, okay? Now, do I touch the wound itself when I measure? No. I'm going to just hold this out, and I'm going to just kind of hold it about an inch away from it and look, and I would say that's about 10 centimeters, okay? By what? So I have to do it the width, too. So 10 by about 10 centimeters by 2 centimeters. And what's the other thing I have to do? Depth. This is where your sterile cotton tip swabs come in. So you open those, and do not touch the top. You're going to take this in about the center, and you're going to take this, and you're going to put it right in the center, the deepest part. Then you're going to take your thumb right up to where the skin is, and that's how deep it is. So I take that and put it up against my tape measure, and I measure and go, okay, that was 1 centimeter deep. That's how you do the depth, okay? Then you discard this and discard that. Okay, you're going to take your gloves off, and you are going to do hand hygiene again.
Would we ever draw it on our charting?
Would you ever what?
Draw the wound?
Yeah, you can. Definitely draw the wound. In fact, I've seen lots of doctors draw stuff on their progress notes. Yeah, that's a good idea. Okay, so then you're going to open this up. Once again, away from you. The first thing on top should be your gloves. Pick your gloves up, and you're going to put your gloves on over here. Making sure that you guys use sterile technique to put your gloves on, all right? You guys, the other thing is when you're putting sterile stuff on, get it off. Get it away from any contaminated surface. That's the easiest thing to do, is just to get it away from the contaminated surface, okay? Okay. All right, so then you've got your gloves on. The next thing that's in here is your drape that you're going to set up your sterile field on. Make sure it is blue side down. Okay? Then you can just start unloading all your goods. So there's your ABD pad, making sure that you've got a full inch around. I'm not going to use that. There's your dressing. Here's your scissors, your tape, your measure, which we already measured. And you've got your roll, and you've got 8. Okay, with your saline, because it's sterile, you can touch it with both hands. Isn't that nice? Now we can open it, because it's sterile. Okay, so you open up the lid, and you dump it in 2 sides. One side's going to be your cleaning, one side's going to be your packing. Okay, so you're going to dump like half and half in each side. It just keeps you, it'll just keep you straight. I promise it's easier to do it that way. Okay, careful not to touch anything. Make sure that you still don't touch anything. All right, then I'm going to take 2 2x2s and put 2 of them in one side, 2 of them in the other side. Okay, remember I'm still sterile. All I've touched is this and this. Okay, now I'm going to clean the wound. So you clean from the least contaminated to the most contaminated. So you clean from the inside out, right? So you take a 4x4, you wring out the excess water, and because I don't want to contaminate my hand, I am going to wrap it around my finger like this, okay? Then I go inside the wound and go. You also don't want to touch the outside of the wound, and you throw it in your garbage.
You're just doing one stroke?
Uh-huh. Just one stroke with each one. And then you clean right just the center. Do not touch the edges. Okay, then after it is cleaned, then I'm going to pack it because it's wet to dry. So you pack it with the wet gauze. So once again, I wring it out. Now, if I needed more packing stuff, like if this was tunneling this way or whatever, I would take my packing stuff, put it in the wet saline, clip it off to where I needed it to, and then I could use this to pack that with, okay? But so this is not a really deep one, so I'm not going to use that this time. So I'm just going to take this. I'm going to just take one 2x2 at a time, and I'm going to fold it up, and I'm going to, now, can I touch it? No. So I touch just the top of this. Okay? When you pack it, you don't want it to be on the edge if you can help it. So you want it on the inside. So you pack it on the inside of the wound, not on the outside. Because what will that cause if it's moist all around the edge? It'll cause the macerations that we were talking about. Okay. Then with the dry one, you put 2 dry.
Could you take your scissors and push it into the...
Yeah, you could. Yeah, you
That
could.
fell out.
Okay, so if that fell out, what do I do?
Start over.
Start over. Okay, so I put a couple more in here. Bring them out. Come back over here. And he had a great idea to take your little scissors here that are sterile. It's really, if it was moist, it would go a little better.
I could tape it just for now.
Okay. Then you're going to put your dry 4x4 on this. Okay? Then you're going to put an ABD pad, your ABD pad on it. And I normally wouldn't hold this, but because... Okay. So now you're going to not be sterile anymore. Once you get to this point. Then you're going to tape this and secure it. And tape with gloves is awesome.
So fun.
Awesome. It's way fun to learn how to do that. Okay, so then you secure that. Then you're going to take and write time and date this. And then this little guy is going to go right here on the patient's dressing. Okay? Or you can just take a pen and write right on the dressing itself. You can do that too. That's not a problem. Okay. The things that you're going to assess for. You're going to assess and document the drainage on the dressing, the color, the odor, how much. You're going to document what the wound itself looks like, color, odor, any exudate date. You're going to assess how the patient tolerated it. After you do it, you're going to ask him again, how is your pain now? If he says his pain's still controlled, then you run with that. If he needs something more for pain, you go and figure out what it is you can get for him. You cover him back up, get him in a comfortable position. You document. Oh, you need to teach him something. So the thing that you need to teach, several things you could teach, is that if it starts itching or hurting, that he needs to not sit and scratch it. And he needs to not take that dressing off. It needs to stay on. If it starts getting saturated, if there's blood on the outside, he needs to let the nurses know, and we'll come in and change that again. So those are things that we need, that we can use for teaching. Also pain management, to let us know, and we can get him pain medication accordingly. So then you're going to dispose of all of your stuff and chart, leave the patient clean, neat, safe, and all the good stuff. So that's pretty much it. You guys have any questions?
I couldn't find the